Hi, my name is Precious. I will be your student nurse today. Today I'll be asking you some questions about your health history. Thank you. Let me know your name. Please tell me your name. Frederick Keith? Okay. Is it okay if I call you Frederick? Okay. Oh, Frederick, when were you born? That's October 30th, 1981. Thank you. So what brings you here today? You've had a headache? Since yesterday? Wow, I'm sorry to hear that. So tell me how you've been before this headache started. How were you? Okay. So you were fine, you've not been sick, and suddenly you had this headache from yesterday. Could you describe this headache? Okay. So it's global. I mean, you feel it everywhere on your head. Is there anything that worsens the headache? No. Is there anything that makes it better? Okay. Okay. So you took a Tylenol? How many? So 1,000 milligrams. That's two of the 500. Okay. And did that help? Okay. So on a scale of 1 to 10, how severe is this headache? So the headache is about a 10. And when you took the Tylenol, how low when you took the Tylenol, what was the pain level afterwards from scale of 1 to 10? It was about a 3. So the Tylenol did help a lot. Okay. Thank you. So have you had any childhood illnesses like chickenpox, measles, mumps, rubella, rheumatic fever, polio, any disease? No. So you were a healthy child. That's good to know. Have you had any accidents or injuries? No. Okay. So tell me, do you have any major conditions like diabetes, high blood pressure, high cholesterol, hypothyroidism, goiter, which is like any swelling of your thyroid? No. Any history of cancer, leukemia, psoriasis, angina? Any heart problems? No. Okay. Have you been told you have a heart murmur? Any history of pneumonia? What about anemia? No. Okay. Asthma? Emphysema? No. Okay. Stroke? Epilepsy? That is any history of seizures? No. Okay. Cataracts? No. Kidney disease? Kidney stones? No. Any history of Crohn's disease? Colitis? No. Any history of pulmonary embolism? What about jaundice? Have you been told at any point you had an increased yellowing of your skin? No. Okay. Hepatitis? No. Any stomach or peptic ulcer? No. Any history of rheumatic fever? Tuberculosis? No. What about HIV? No. So no history of any disease. Okay. Do you have any other medical conditions? No. Okay. All right. Have you ever been hospitalized? No. Okay. So you've been pretty healthy. Oh, that's good. Healthy, Frederick. All right. So have you had any operations in the past? No. Any surgeries? No. Okay. All right. So I'm going to ask you about your immunization history. Okay. Have you had your tetanus shot? Yes. Okay. When did you have it? About 3 years ago. Okay. That's fair. Have you had any hepatitis B shot? Probably when you were a child. You don't remember. Okay, it's fine. We'll leave that alone. What about a meningococcal shot? You don't know either. Okay. What about the COVID-19? Have you had your COVID-19 shot? Yes. When did you have that? July last year? Okay. All right. Pneumonia shots? No. Chickenpox? You don't remember. Okay. What about the measles, mumps, and rubella? You think you had that as a child? Okay. Okay. Let's say as a child, how old do you think you were? You don't know. Okay. Just put that you had it as a child. Hepatitis A? No. What about the influenza, the flu shot? You had it in January this year? Okay. All right. So tell me the date of your last physical exam, your annual physical, when you had to see the physician. November 2021. Okay. What about the vision test? When was your last eye exam? You had it this year. When? February? Okay, February. Tom, have you had any electrocardiogram? No need for it. Okay. Have you had a colonoscopy? No colonoscopy. Okay. And what about your last dental exam? You haven't seen the dentist in 3 years. Okay. So last dental exam was about 3 years ago. All right. Have you had any hearing exams? No. What about chest x-ray? No. Okay. All right. Do you have any allergies? No, you're not allergic to anything. All right, that's good. So there are no known allergies. So you did mention you took Tylenol for the headaches? Yeah. And you took about 1,000 milligrams. Yeah, and yeah, headache, the reason. Okay. Besides Tylenol, do you take any other medication? No. Okay. What about vitamins? No, not at all. Okay. All right. Well, that's good to know. Well, thank you for taking your time today to tell me a bit about your health history data. I do appreciate this time and thank you and do hope you have a great day.